everyone, Dr. Mac with another video today. I have a lot of requests from this video from a very long time since I started my YouTube channel. How to start my part 1 journey. Could you please help us what to study for part 1, how to start studying for part 1, what are the considerations that we should have in our mind when doing the part 1 training. Today, we're discussing all about your part 1 exam. We are only talking about the written exam for the Australian Dental Council exam. Disclaimer for all of you, it might be a bit longer video, but it's very important to understand the concept behind everything. If I just tell you, and a lot of people say, just tell us 2 books that you recommend. No, it's not, doesn't work that way. You need to know all the whys before you proceed into this journey. And that's why it's important to do a detailed video. So let's talk only about ADC part 1 exam, the written exam. What, in my personal experience, you should all be studying and what are the things you need to have in mind when you're studying for it. All right. First of all, and I've made a small list here today because I want to make sure this video covers everything so maximum people can benefit out of it. First thing, we need to understand why there's a change in the patterns. Why does ADC change the pattern? Recently, we had a change in pattern for the part 1 written exam as well. Why is there a change in the pattern? Why every 5 years ADC changes the pattern? But recently, you'll notice the new pattern is more clinically inclined with the practical exam. Why is it happening? We need to get the basics or just a bit of background. Previously, if you notice, the exam patterns are more like, just if someone can do a good crown prep or if someone have done a good memorization of some theoretical books, like basic one-liner questions like what is the percentage of hydroxyapatite in enamel, what is the percentage of hydroxyapatite in dentine, like they've memorized it. It's like rutification, we call it. It's like 2 2s are 4, 3 3 is 6, Even some of the less experienced clinicians were passing it more than the clinical experienced clinicians. They were suffering to pass this exam because it was more on the theory. If someone has actually memorized the theory a lot better, they can pass it. But now ADC has realized in the past years and with their feedback as well from actually the clinics that a person who can do a really good crown prep, they go tomorrow and they sit in the clinic and they start handling patients. They can't even talk to the patients. They can't even manage a patient. They can't even make a diagnosis, but they can do a beautiful filling. They can do a beautiful crown prep. They know how to pull the tooth out. But to reach to that stage of pulling the tooth out is more important than doing the treatment itself. It's about you dealing with life. You're not actually, doing a treatment on a mannequin head where you can do whatever you want and they're not gonna reply back or they're not gonna feel anything. We're dealing with a human. So we need to make sure your diagnosis, your management, all the initial steps are there, and then you know how to pull a tooth out, or you do know how to do a filling, or you know how to take an x-ray. That's what they're focusing on. And that's why you notice that the initial pattern change now to what it was previously. It's more inclined towards a part 2 exam now. You can also see people failing in part 2. Where are they mostly failing? You can see most of the results because I teach part 2. The practical exam, they're mostly failing in diagnosis, management, cluster, endoscopies, information gathering. Everyone's failing in that. They're doing a crown prep, they're passing everything else. They're failing in information gathering, clinical information gathering. They're failing in diagnosis and management clusters. They're mostly failing in infection control. So that basically suggests us that yes, there are clinicians, but they're lacking in the main foundation. And that's what working in a clinic in Australia with experienced clinicians, you'll realize they're good at talking to the patient. They're good at communicating the problems. They're good at explaining and formulating and diagnosing the problem, then the treatment. And that's why a good clinician is not someone who can do a really good crown. A good clinician is someone who can formalize a treatment plan. They know what needs to be done from A to Z, and then you can even refer that to another person, but that's most important. The first thing we need to understand why there's a change in pattern, because now Australia is looking for not just dentists who knows how to do a crown prep, but they're looking for all-rounders. They're not looking for perfectionists with a crown prep, but they're looking at people who can do good, mediocre, good in all the elements. Not just one fully they're just drilling. No, that's why it's important to understand. So the first thing we need to understand, why is it changing? Because now it's more focused on the practical approach, more getting involved with the clinical concept. It's not 2 2s are 4, 3 3s are 6. No, now we're looking at clinical based scenarios. Previously, there were single liner questions and some scenario based. Now, if you notice, they're mostly scenario based questions in which you are basically dealing a whole case. If a patient comes, this is the diagnosis, this would be the management, this would be treatment, the whole thing. And that's where it comes to, and we'll discuss it more in detail, which books to study. So the first thing is more related to why is a change in pattern? You need to start thinking about, to incorporate those clinical or practical approaches in your training as well when you're studying about it. Second thing is how to enroll. Now, how to enroll, ADC is divided into 3 parts. First, you make an account with the Australian Dental Council exam, which is the ADC Connect. You do your initial assessment, in which basically they're assessing if you have done a genuine 4 to 5 years bachelor's degree in dentistry and you have done it from an accredited college or university. And then, yes, you are eligible to sit in the exam. If you've done a BDS or dentistry 4 to 5 years, you'll be fine. Majority of you have done, whichever country you've done it from a genuine university, you should be fine. All right. Second thing, how to enroll. It's once you go through the ADC Connect, it automatically is an online thing with the peers and you book your exam. Part 1 generally happens twice a year in March, end of March, start of September. So there's 2 dates available. So I would personally say dates are there. Once you get the initial assessment done, you can start studying and then you will get a date. You can book a date. The exam happens all around the world. I think it happens in Dubai as well, for a lot of people wondering. Happens in pretty much all the cities in Australia as well. So you can always check with ADC about the venues and where you can actually give the exam. It's an online based exam. You have to go to one of the Pearson centers to give the exam. It's a computer based exam. It's divided into 2 days. The first day it's 4 papers. The first day you get MCQ based, scenario based questions. You do it in the computer, basically take the right marking, like a choice based question. The first day is 2 papers. The other day is 2 papers is divided into 2 days. And I think it starts at 8 in the morning and then you have break in the middle between the 2 parts, something like that. So details are there. Fees wise, it is around $2,000. Once you have done the initial assessment, everything, now it comes to what to study and how to study and how long does it take me. One thing we need to understand is you have to take ADC as a journey. I always say to everyone, don't rush it through. Make sure you are equipped, you are ready for the exam before you jump in, then dive in and say, okay, let's give the exam. No. Make sure you are well prepared for it, then give the exam. A lot of times the problem arrives when people are not ready, they have not even prepared for it, they have not prepared enough, then just go and just give the exam. So you're relying on how one of the most amazing clinicians, and I love that person, Lincoln Harris, amazing clinician. He says, don't rely on luck and pray. The problem is, when you rely too much on luck and pray, you are basically relying that yes, it will happen. But how about if it doesn't happen? are you want to risk with your journey? And I know most of the people coming from overseas, that's why they're doing the dental license exam. We don't have a lot of money to spend again and again, unless you have it. You don't want to just sit in an exam, which is an expensive exam. It's not a bit, it is an expensive exam with your part 1 and initial assessment, then your part 2. It's a journey, right? It's not an easy exam. So you don't want to spend money on something when you're not ready. So please don't go with the luck and pray concept that I'll pray, 50% prayer, 50% luck. No, if you think you're not ready, look at the pass rate. It's like 150 or 300 people give, only 20, 30 people are passing, Look at the ratios. You will notice that, if out of 100 people, for example, 15 or 20 are passing, do you think you're in that 20? Have you worked hard enough? Because I always tell everyone, it's not because you studied wrong or bad. Someone studied a bit better than you. And ADC, you have to understand this. You'll have to make sure that if the pass rate is out of 100, 15, 20 people are passing for part 1, are we talking about? Have you worked hard enough to be in that 15? Because if someone has worked harder than you, they're going to take your place. Second thing is, which books to study? Now, the reason I'm telling you is start formulating why they're changing patterns is they're looking for clinicians who are sound with their practical knowledge as well. They're not like 2 to the 4, 3 to the 6. They've just memorized all the theoretical knowledge. And then tomorrow they go and sit in the clinic after passing ADC. They don't really know anything. They can't even deal with the patient. They can't even do a single diagnosis. That's the problem happening these days, that people are passing, but now they're not even ready to sit in the clinic. They're like, oh, I can't go and see a patient tomorrow because I'm not ready. Yes, I've passed the exam. So they're trying to change the pattern so the clinicians who are passing the exam are actually well aware. Yes, they've passed the ADC, they've went through the journey, but previously they had no experience, or they're not truly prepared to actually start seeing patients from tomorrow. When a dental graduate, Australian dental graduate goes, which they consider as a fresh graduate, not everybody is ready to go, and they need some mentorship. They say, we would really like to work in a clinic. There are already 3-4 clinicians there who actually help us with their journey. Same with the ADC. Some are really good clinicians. They're happy to be working alone. They had their past experiences, or they were prepared in a way, but some are not. So you are basically same in conjunction with the fresh graduate. And that's what it's important to understand. Now, which books to study? I'll tell you a couple of books, and I would like you to search for them. Do not try to start messaging again and again that, Dr. Mac, can you please find me a book? That's my biggest concern when I start teaching people. And what is your research then? If I tell you everything and if I give you my notes, what is your research? What hard work have you done? How serious are you in your journey in passing your part 1 exam or with your ADC journey? If you cannot even search a book. And when I say go and search a book, that means when I search it, I can find all those books in the internet, on the Facebook groups, everywhere. So if you cannot find it, that means either you haven't worked hard enough, you haven't done your research, or you haven't done your homework hard enough, or you're not even serious with your ADC journey. Again, I will tell you that some of the books in my knowledge and my experience, they're very essential for your part 1 journey. And when you're starting your part 1 journey, these are the books should be your main guidelines. But do your research in finding them. Okay? The first book, which is very important, and I'll try to mention the name of the books in the comment sections below if I can. That would be helpful for everybody, the list of the books. The first book is the Therapeutic Guidelines. Now, Therapeutic Guidelines is a small purple book. I'll see if I can add a picture of it as well during the video. It's a small book, but it is the most essential book for your part 1 and even later for your part 2 journey, and you'll realize it once you go through the ADC journey. Now, there was a new pattern published as well for it, new edition for the Therapeutic Guidelines, But if I was you and I'm doing through my part 1 journey, I will study both the books. So get the previous edition and the new edition. Try to highlight the difference. Do not underestimate the size of the book. I've seen most of the students, they say, oh, I've done Therapeutic Guidelines as a small book. Do not underestimate the size of the book. It is a small book. However, the knowledge is extensive. The knowledge is vast. You have to read every single word. Go through the book 5 times and memorize it badly. And tomorrow I'll ask you a question. I'll promise you half of the people, or I would say 75% plus population will not know that answer. And it will be from the Therapeutic Guidelines. Because a lot of people have just swam through that book. They haven't actually studied it. And that's where it comes place that, when we say, oh, I'll get someone's notes, I'll get someone's books. What the research have you done? Have you created your own notes? My father always tells me, still keeps telling me, if you read, you forget. If you write, you understand. If you discuss, you remember. And this is so important to understand. If you read, you forget. If you write, you understand. If you discuss, you remember. Now, the main problem is that we are more focused on getting the notes from someone. We're not doing the research. We are not writing things down. So how will we remember? We will forget again and again. And that's what happens with the majority of the people. They don't discuss, they don't write their notes. They just have half of the books and they're like, oh, now when they ask you the question, they don't even remember what's happening. Make your notes, make your own notes, make your bullet points, discuss with your friends, and only then you're going to remember. So Therapeutic Guidelines, both the previous edition and the current edition, very important book. Secondly, as I said, the exam is now going towards scenario based and the practical approaches rather than just theory one-liners. You need to read books or try to get materials that give you a scenario based concept, which is case-based study books in which you have a full scenario in which a patient comes with pain or a broken tooth or with a big swelling or a Wells tooth or fever. What are the signs and symptoms, how to diagnose it, how to manage it, how to treat it. The whole patient from A to Z, from initial diagnosis to the treatment, you need to study those books. Now, the most essential book for your journey after Therapeutic Guidelines, very important book, is Odell's Clinical Cases. You'll have to get that book for your part 1 journey. And later it's going to help you with your part 2 as well. Odell's Clinical Cases. I think this book is really good. I think you have a new edition of the book as well. So get whichever you can get, or you can read both. I think it's around 60 cases, and it's like from start to end. And reading those books is going to give you an idea about a full patient, and it's going to open your mind. Now you want to start becoming clinicians who can diagnose, manage, who can understand the problem, and then go to the treatment. Not go to a treatment directly like doing a crown. No, and that's what they're trying to change, and that's what the pattern is going to be now as well. That's why even when you find a mentor or someone who should be experienced enough that they can actually guide you through your journey, even then, and we'll discuss it later in the past papers, you still have to do your own research. You can't just rely on anybody and anyone out there. Okay? Odell's Clinical Cases. The third book, and a lot of people are not aware of it, it's Odell's Clinical MCQ book. There are 2 cases, Odell's books. One is an Odell's Clinical Cases in which they're all the cases. The second Odell's book is all scenario-based questions with answers. So basically what's happening is you have all the questions of the same first book, they have scenarios, questions, and answers with that. So then you start to understand what kind of questions are coming in the ADC exam in a scenario based and how to answer them. So your mind is opening now on not just single line of questions that's theoretical based, completely like you can memorize or ratify it. No, you can actually work on those, which is very important. So 3 books now. One is your Therapeutic Guidelines, both the first edition and the second newer edition. The second one is your Odell's Clinical Cases. The third book is your Odell's Clinical MCQs. Okay, now we have basically 4 books in a way. 2 Therapeutic Guidelines, 2 Odell's. Now, the third book, which I would like you to read, it's not as important as Odell's, but it's good for you to understand again the scenario-based concept, and it's related with implants and fixed prosthodontics program. And it's a very good book as a mind opener for you to understand those cases, because it does help you with those implant questions about those prostho cases. It's a clinical prosthodontic case book. I will exactly mention the name of that book in the link below. If I can put a picture here as well, I will put that for everybody as well. So very good book. Again, it has all those scenarios from how a patient presents, a presenting complaint with the clinical photos, and how do you actually assess, formulate a diagnosis, treatment plan, manage the whole case and treat it. And then it also gives you MCQs that you actually know the right answers to as well. In the end, you can solve it. So every scenario, and then every scenario ends with 10 or 12 or 5 MCQs that you can solve. So you get an idea about how a scenario-based questionnaire comes. And this book would be the 5th book, or after Odell's and Therapeutic Guidelines, the 3rd book, which in my opinion you should definitely read, because now it's coming more towards the practical approach, and these books would be a very good book for making you an idea about scenario-based questions and giving you that essential knowledge that it's hard to get just by reading a textbook. So this book would be a very important book, in my opinion, that all of you should read. All right, so I've got the name of the book finally. It's by Wiley Blackwell, Clinical Cases in Prosthodontics. Clinical Cases series. And it has almost, I'll have a look exactly, 37 cases. 37 cases from start to finish, what's the presenting complaint is, how to manage, diagnose, treat, and then MCQs with right answers that you'll be able to solve, and then you'll be able to see exactly the right answers. So these books would be, I would say, really important. The 4th book, in my opinion, then comes to, you have to start getting an idea. Now you can keep getting more books like this. If you have more time, you can study more as well. They are master clinical dentistry books that is again like Odell's, in which you have different scenarios and you have MCQs at the end. It allows you to solve. Some don't have MCQs, some have MCQs, but it's more like scenario based. You have a full scenario, like a patient walks in the clinic with, this is the major complaint, this is a clinical features, these are the radiological features, what is your diagnosis, how will you manage it, how will you treat it. So then you're dealing a whole patient, and that basically opens your mind. So master clinical dentistry series as well. But I would personally say Odell's Clinical Therapeutic Guidelines, main books, properly read it. Clinical Cases in Prosthodontics, Clinical Case Series, very good book. Definitely have a read at least once or twice. Then comes to different articles, different journals, different reading materials. The most important thing when we are practicing in Australia as a clinician, I'll see in part 2 a lot of a lot of your candidates or colleagues fail again and again. They don't understand the infection control guidelines. So very important, infection control guidelines. Please read it. And don't just read it, you have to start understanding it. And how to understand it? How did we actually discuss earlier? You read, you forget. You write, you understand. You discuss, you remember. So make your notes. Formulate something that actually allows you to remember it, and then you discuss, you will never forget it. Infection control guidelines. These days, it's also very important to understand, looking at, is there any newer changes happening in dentistry? What is one of the most common questions you get? Perio cases, perio-based scenarios, periodontal involvement, periodontitis, gingivitis, whenever you have gums involved. Perio classification. You'll see that recently there was change in the periodontal classification. It's not the old one anymore. Have you read about it? Very important to read about it as well. So this is very important. If you feel there's now a change in a caries classification, that the international normalized ratio is changed now, and now the caries classification has changed, you better read that article. If you feel like that there's new research that tells you the amount of fluoride given to kids or amount of fluoride given to adults and what is its impact on it, read about it. Read those articles. It's about continuous development happening. Anything in relation with Australia, it's not about just textbook. They want you to start looking like this to open your mind and start looking at a full picture on how to diagnose, manage, and deal with the whole patient. So these articles would be very important for you. So Odell's clinical, both the MCQs, both the booklet, Therapeutic Guidelines, don't underestimate this book. Then you have the fixed clinical cases in prosthodontics. It's basically related with prosthos, and then it covers the implant cases as well. It covers the partial denture, fixed dentures, which are bridges, fixed clinical prosthodontics. Then we have the things like combination syndrome and things like that. It opens up your mind. It's very, very important to read these. Then we have articles, as we did discuss, infection control guidelines, very important. Any change in classification of caries, periodontal. Okay, so discuss this, study about this. Now it comes to, should we do courses? Should we not do courses? Now, first thing is, we are worried about money. We don't have money, we have money. Unfortunately or fortunately, whichever way you want to see, ADC exam, it's an expensive journey. Part 1 is a lot more cheaper compared to part 2 because you have to spend a lot more. This is just the beginning. Yes, there is an expenditure involved. My only query is there a harm in doing a course? Any course you do, it's going to teach you some. Now, the only thing that worries me, or which is important for all of you to understand, which a lot of people say, Dr. Mac, you tell me which course to do. Tomorrow, if I tell you that you're buying a car, go and buy a Mazda or go and buy a Toyota or Hyundai, I would tell you, no, I want you to go and buy a Mazda 3 2021 model. Will you listen to me? You'd be like, that's what Dr. Mac thinks, right? I'm going to make sure I do my research. I'm going to test drive the car. I'm going to look at all the features. I'm going to ask my friend. Even after doing all the research, even then you will say that, oh, actually, it's not for me. I'm going to buy Kia Sportage or another car, for example. So this exam is the most important exam of your life. Your whole life is dependent on it. It can be a life-changing thing for you. And you're just relying on one person saying that which course do I do? Again, it comes back to the same thing. When people start messaging, can you please send me this book? What is your homework? What is your research involved with it? Are you serious enough for this exam or no? So do your research. Look at which course is better. Is someone who has just recently passed part 1, has he started teaching just recently? Or is he teaching from 10 years or 5 years? How experienced he is clinically? Just do your research and then make a judgment that should I do a course? Does it fit in my budget? Is it going to give a high impact to me or not? Then make a decision. Secondly, it's very important when it comes to buying courses or buying past papers. You will notice the previous past papers were different because the exam pattern has changed now. That's number one. Number two, and I'm telling you from my experience, first-hand experience. I'm not telling you because that person told me. I was one of the people who never believed in what people are saying. I did my research. And with my research, I proved it. And we had 4 friends, including myself. We used to do research on every single question. And what we actually find out and finalized is 70% plus answers that are given to you. And people say, oh, I've given you the past papers, are wrong. You will see people failing the exam again and again, and they keep coming and tell you that, oh, there was a repeated questions, I knew everything. What is the guarantee that the exam question or the answer you got in the past paper is correct? Who told you that? What's your guarantee? Are you going to believe in someone who's actually just you buying the notes from? What's the guarantee they're giving you the right answer? Have you done your research? I have a full journal that I created on MCQs and the right answers, and 70% plus were wrong. We corrected the answers. But tomorrow, if I give that book to everybody, what is your research involved? How serious are you? That's the problem. When you are willing to give for this exam or not, that makes a difference between someone passing and failing, because how serious they are, how passionate they are, how much hunger they have. And that actually, you don't have to come and say it because I'm really passionate about this. No, your work that you put in says it all. You don't have to say it. So whoever course you're doing, and if someone tells you tomorrow that, oh no, this fluoride percentage is this, you don't listen to them blindly. You do your research, especially for part 1 exam. When you have scenario-based questions, yes, you get the guidance, but then you don't believe in everyone what they're telling you. You have to do your research. Especially be careful with past papers, because majority of the question you'll get might not be right, and you feel in your mind that, oh, it's the right question, and you fail. Third thing, and as I said, I made a list for making sure we're not missing everything, which is being careful with repeated questions. Why is it very important to be careful with the repeated questions? First, that the scenarios are changing. Secondly, ADC is very, very clever. They're not that stupid. They're going to give you the same scenario and then everybody knows the answer. Same as part 2, that now, like the ADC knows that everybody knows the clinical scenario. They know it as well, right? In the OSCE scenario. So they're gonna give you the same question, but they're gonna change 2 things in that whole scenario that diverts the whole question to a completely different direction. Let me repeat this again for everyone. They're gonna put 2 things in the question. They're gonna divert the whole thing to a completely different area. So whenever you get a repeated question, stop, reassess. Don't be like a clever genius who is gonna act stupid out there that, oh, I know this question already. No, when you see a repeated question, be more careful, because ADC must have 99.9% of time tricked you now. So read that question again. And it happened with me as well. I read the question and all of a sudden I was like, boom. They're asking completely something else. And I could see people's faces in the exam. They were like, oh yeah, it's so easy. It's on past paper. But then you start discussing, they'll notice, oh, actually, I diagnosed this wrong. Now, what happens with scenario-based question? Why it gets tricky? Because the 5 questions are talking about the same topic. So if your initial diagnosis is wrong or you did not read the question carefully or correctly, the whole thing moved to another direction. Now, because it's a scenario-based and your diagnosis is wrong, the second question that comes in conjunction with it, you're gonna mark it wrong as well. Third, fourth, fifth, you don't have one question wrong, you failed the whole scenario. That means you have 5 questions wrong now. And that's where the scenario-based questions are tricky. And that's why it's important. Every question you have to make sure you read again. See what they're asking you. When I teach communication or part 2, I always tell them the skilled OSCEs, communication OSCEs, clinical scenario OSCEs, yes, you answered me everything, but I'm going to fail you. I'm going to give you 2 out of 10. What was the question I was asking you? And what did you answer me in the whole next 10 minutes? That's most important. So repeated questions, your trigger should be on here. The mind should be now on a red zone that, okay, so repeated questions, please be careful. Past papers, please be careful. Do your research, get the right answer. Again, we've already discussed about which course to take. Again, do your research. Find a clinical person or a mentor who's actually teaching from a long time. Also, very important, again, I personally feel, it's very hard. Like, I don't want to make judgments on anyone, to be honest. There are really good mentors out there. There are really good clinical people out there who teach. I don't teach part 1 because I'll be very honest, I don't have time. And I personally feel I passed it without any course as well. Part 1, you can pass without any course. Part 2, you cannot. It's very rare. Part 2, you really need guidance. Part 1, you can pass without any course as well. And that's one of the reasons why I only teach part 2, because I want to invest all my time. I don't want to teach 3 things and do not justify my teaching in one. I feel like teach one thing and teach it so good that you can justify what you're doing. And that's why I don't have time for part 1, and that's why I can't give that time. And I feel like I won't be able to justify. And that's one of the reasons I don't teach part 1. So when you find someone, see how long they've been teaching. What sort of clinical experience do they have? Because it now doesn't come to theoretical knowledge of someone giving you a good presentation. They need to share their clinical knowledge in cases so you can understand the crisp of their practical experience. So do your research, find someone out there, which would be very important. Now it comes to, and I mentioned here, importance of past papers. See, importance of past papers, as I discussed earlier as well, it's useless if you don't do your research, because then you're relying on someone to give you the right answers, and it may not be the right answer. So then it's an issue, because you're relying on someone who's basically, the whole journey of your part 1 is reliant on getting the right answers or wrong answers. And do you want to risk your whole journey on someone else? I did not risk it. I personally would not suggest anybody to risk it. But it's good to have past papers. The only thing you need to understand, the pattern has changed now. Half of the past papers might not even fit. So it's not like one size fit all. If I wear a medium, you will wear a large, someone wears extra large, someone wears small, someone says extra small. We cannot have one shirt for everyone, one blazer for everyone. Same as with you all as well. Now it's different. So I think only twice the exam has happened now, or 3 times maximum. It hasn't have a lot of past papers available for people now. But one thing I'll tell you, they're bringing in more the part 2 pattern. They're bringing in more management, information gathering about the cases in which they want to see clinicians who can actually manage a patient rather than someone who has actually memorized 20 books. And that's how we were taught in overseas, right? You memorize the book and you will get first position in the class. But tomorrow you sit, and I've seen that. And I'm not judging anyone out there, but I've seen this, that someone who is amazing, had amazing grades, are not as good clinicians. That someone who had very mediocre grades, but they're better clinicians. So grades don't define how excellent of a diagnostician or a clinician you are. So it's very different scenario than some foreign countries who basically judge you in a holistic manner, not just on that. And you'll notice their students, or some universities even overseas, who are actually following that pattern, their students are actually more knowledgeable. And when I say knowledgeable, it's not about if someone scored 90 out of 10 out of 100, or like they've scored 99% or 200%. It's about how good they are in their practical approaches. Because at the end of the day, it's not about how good of a crown prep you can do, if you can actually manage a full patient. And then your associate can do a very good crown. But if you don't know how to manage a patient, you won't even reach to doing a crown, because they're gonna do an initial consult with you and they're gonna go to a clinic next door because you did not even explain them what the problem is. All right. So past papers are only good for, you know the answer now. Mock exams. Mock exams are very good. Mock exams are very good. I feel like a lot of academies even offer free programs. I know Dr. Bedo, West Med Academy, he offered free mock exams for students. You can always contact him. You can always, if someone else is doing a mock exam, do mock exams. Mock exams are good. They are like a complete reflection of your work that you've put in. Because as soon as you finish a mock exam, you will know like actually, you know, how much prepared you are for the exam. So mock exams would be a very, very good thing. I would highly suggest it. Dr. Bedo, Westmead Academy, the reason I take his name is because first, he's quite old with the ADC process. He's a very experienced clinician. And when you come to practical approaches, he is someone who can give you the knowledge, or his teaching, I would highly, not just highly recommend, but I would trust his teaching because his experience supports him. And that's what I'm saying is, again, find someone who fits those criteria. How experienced he is he working in Australia or not? How long is he working in Australia? How much is he teaching? How long is he teaching? And does his clinical practical approaches support his theoretical background, what he's giving you? If someone supports that, go to his course. If that fits in your budget, go to his course. Again, please understand this. Don't blindly trust anyone out there. At the end of the day, it's your journey. You will get the pass or fail result. So please, after you go to any mentor or get any past paper or get any theory or answers or questions, you have to do your honest research on it, then question it, critically analyze it to reach your diagnosis on what you think is important. So very, very important. But yes, I highly suggest you do the mock exam. So you feel that, you know, how much have you prepared? You know the answer. It's a critical reflection on your learning. All right. So very, very important. So we have discussed why there's a change in pattern, why the patterns are changing, because they want clinicians to have more practical approaches, how to enroll, ADC Connect, make an account on the ADC website. Fees, I think it's around $2,000. How much time you need? Everyone's different. Someone can do it in 3 months. Someone can do it in 12 months. Someone can even not do it in 5 years. Everyone's different. So whatever time you feel it takes you, give it to that. Don't compare your journey with someone else, because this person did it in 3 months. I will be able to do it in 3 months as well. This person did it in 6 months. No, everyone's different. Start studying. Generally, the initial assessment takes you somewhere between 3 to 6 months. Sometimes it take you even more. So by the time your initial assessment you have submitted, start studying these books that I've mentioned. Start studying and preparing for a Part 1 exam. So by the time you're getting a date, or you are going for the March or September, which one, you already know that, okay, for the March attempt, I already have another 3-4 months. Am I feel ready? And then you basically go with that. Okay. Repeated questions. I've actually emphasized quite a bit on that. Please, repeated questions, trigger alarm should be up. Past papers, find the right answers. Some of the past papers may not be useful anymore. However, past papers, good. Books to study, Therapeutic Guidelines, both in pre-version and now the current version, Odell's Clinical, your cases and the MCQs, clinical cases in prosthodontics, the clinical case series. You can go to Master Dentistry Clinical Series, scenario-based. These books would be the main aim. Then Infection Control Guideline, New Perio Guidelines, and all those. Any changes in the caries guideline, or do your research. What's the latest trauma guideline? Is there any changes? Do your research. Holistically, you want to become a good clinician now. Okay? Very important. And all this knowledge is not going to go to waste, by the way. It's going to be helpful in your Part 2 journey. Another book which you can read or you can think about it is a version 4 OSCE document. All the cases coming in the Part 2 exams, all the clinical OSCEs, communication OSCEs, they have like all the cases in there. Again, you don't have to go in and dive deep into. Half the questions are from Odell's anyways. You have a bit of an idea that, if it's oral enteral communication or an angry patient protocol or something like that, you have that extra knowledge. So tomorrow there might be an extra question in there as well. So ADC version 4 OSCE document, I think it was created by someone, amazing clinician. I don't know who that person is. I think it was Denham or someone. I don't know exactly, but great clinician. What he basically did is, once the new pattern came that they're going to add OSCEs now, in communication as well, there was one person who, when we were having all the discussion, he combined all the discussions in one document. So again, do your research. Do not start messaging me that, I need this book. Do your research. Show yourself how hungry you are for this exam. And I can assure you, if you are hungry and passionate about it, you'll be able to find 200 other books that nobody has told you before. But if you are not serious about this exam, you will be still finding excuses that, this book is not available. How much work did you put in? How much work did you? Maybe you did not. Okay. So work on these books, and I will make sure I have those, all the name of the books in the description below. And if I can, while I'm talking, if I can edit it and put the cover of that book as well, I'll do that for all of you as well. All right. So I think I have pretty much covered everything, and that should be good. So my best wishes for you for your Part 1 ADC journey. Again, work hard. The problem with ADC journey is everybody wants the prize, and this is one of my favorite lines. I heard someone saying it actually. Everybody wants the prize. Nobody wants to pay for the prize. And in simple terms, the thing is, everybody wants the gift. Everybody wants to be a dentist in Australia and have that lifestyle and enjoy that journey, but nobody wants to work hard for it. Very people who want to put in all the effort to do it, they all want the easy way out. So do the hard way, do your struggle, do your, all the necessary efforts required for the exam, and you will find all the books. You will find everything. One thing, after you've done your research and you're really struggling, I would like you to comment on this video. Comment which book are you struggling to find, which book do you need, and comment below with your email address. And I would request someone to send you some of the books if I can find them. All right, but do your research. I'm very sure you'll be able to find them. Otherwise, comment below. Let me know if you have any other questions about the part 1 that you are confused, any other queries that always bother you when you start your ADC journey, and then at the same time how this video has been helpful for all of you. And then at the same time, if you feel you can't find one of the books, comment below on which book you cannot find and what have you done, and then your email address, and then hopefully someone will be able to send you the book out to you in an email if I can. All right, God bless you. My best wishes for your part 1 journey, and hopefully we see you soon in the part 2. All right, God bless you all. See you all in the next video.